Effects of diabetes on the newborn. Diabetes in pregnancy negatively affects both mother and the unborn child. At the point when a woman has diabetes and her blood sugars are ineffectively controlled, too high, excess amount of sugar are shipped to the child. Since the child doesn't have diabetes, he or she is able to increase the production of insulin considerably so as to utilize this additional sugar. This abnormal cycle of event brings about a few complications. Please, if you're watching this video for the first time, kindly subscribe to this channel, hit on the bell icon, so that anytime I drop a video like this, you will be notified, and please don't forget to give this video a thumbs up. These complications include 1. Macrosomia, large baby. Macrosomia refers to an infant gaining more than 4,000 grams (8.8 pounds), or born at greater than the 90th percentile for the gestational age. In light of the excess amount of sugar that the infant gets, a lot of insulin are produced by the infant so as to change over the sugar into body fat. That is, the child is being overfed while inside the uterus. Therefore, the delivery can be more hard for the infant and the mother, with increased risk for injury to both. Also, the chances of requiring a cesarean delivery can be a lot greater when the child is excessively big. Most obstetricians perform an ultrasound to appraise the fetal weight before delivery and to decide whether it is safe to have a vaginal delivery. Attempting to deliver a large infant vaginally, especially when the mother has diabetes, can bring about one of the most alarming obstetrical crises, a shoulder dystocia, where the infant's head delivers yet the shoulders are too huge to even think about fitting through the birth canal. 2. Neonatal hypoglycemia. Neonatal hypoglycemia is characterized as low blood sugars in the child after birth. In the event that the infant's pancreas is making a lot of insulin in response of the mother's high blood sugars, it will keep on doing as such for a period of time after delivery. Since the sugar supply from the mother is no longer present, once the infant has been delivered, glucose can drop excessively low, hypoglycemia. The child can become fussy, jittery, or may even have a seizure or breathing issues. In light of these potential complications, most infants born to women with diabetes will be observed intently for the initial hours of life with visit heel sticks to check their blood sugars. These infants may require more frequent breast milk or bottle feeding to keep up their blood sugars at a typical range, and at times will require intravenous liquids with glucose. 3. Stillbirth. At the point when blood sugars are steadily high, blood vessels harm the placenta and poor oxygen supply to the child can happen. This reduction in oxygen may cause health damage to the child, including death or stillbirth. This seldom happens in pregnancies complicated by diabetes in pregnancy, and is bound to happen if the mother had diabetes preceding the pregnancy or after the pregnancy. Along these lines, women with diabetes before pregnancy ought to be checked all the more intently toward the end of pregnancy. 4. Birth defects. Looking at the general population, there is around a 2 to 3% risk for having an infant with a major birth deformity. Infants born to mothers with diabetes before pregnancy don't have more risks of birth defects than the general population. In women with diabetes before pregnancy, this risk is increased around 3 to 4-fold, especially if blood sugars are high during the early weeks of pregnancy. This is the developmental period when the infant is forming its fundamental organs. The risk for having a child with one of these birth defects is legitimately connected with how ineffectively the glucose was controlled during the initial first week of pregnancy. The most well-known birth defects are those of the brain, spinal cord, and heart. Most of these birth deformities can be identified during the first weeks of pregnancy with ultrasound studies and prenatal diagnostic tests. Having diabetes doesn't build the risk for having a child with a chromosome issue, for example, Down disorder, over the age-related risk. The way to limiting the dangers for having an infant with a birth deformity or other complications of diabetes is to have a pre-pregnancy counseling so as to upgrade glucose control before getting pregnant. For more information on how to get the best diabetes cure of all time, I have left a link below to guide you on the best diabetes cure of all. Also, if you have any question that you will like me to answer about diabetes, please leave a comment below. I will read and make a video about it. Thank you for watching, and see you in my next video.